Hi, I'm Michael Marin. At Holy Name Medical Center, we believe that all citizens need to be informed about the important healthcare issues that affect their daily lives. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community. Horizon Blue Cross Blue Shield of New Jersey. Bloomfield College, offering small classes and big opportunities since 1868. Wells Fargo. PSE&G, committed to improving New Jersey's economy and strengthening its communities. Holy Name Medical Center in Teaneck, New Jersey. Healing begins here. And by Johnson & Johnson.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Steve Adubato here. We're at the Newark Community Health Centers. We're here with a very important person from the federal government when it comes to the Affordable Care Act. She is Jackie Cornell-Bechelli, Regional Director, U.S. Department of Health and Human Services. Jackie, it's so good to have you with us.
Thanks for having us today. Appreciate being here.
We are, in fact, here, and people are being signed up as we speak for the Affordable Care Act, the health insurance that everyone talked about, and it's happening as we speak. What's that feel like for you?
I think it's really exciting to see all that we've worked for come to fruition in these 3 months of the open enrollment period. So it's so great to see so many members of the community out today and throughout events throughout the state of New Jersey getting enrolled every day.
You know, a lot of lessons that people take from the first enrollment period. First, healthcare.gov. How's it doing?
It's doing great. It's doing great. You might have seen we have a great new feature called the window shopping tool. So
the window shopping tool, what is it?
So just like you shop online for anything else, you don't need to log in or create a password. You can just go browse, see what's available. You put in just a few pieces of information, your age and your zip code, and you'll see what packages are available to you. And so we've tried to make it as easy as possible for the consumers to get the information they need without as many hurdles and boundaries. And in terms of the website, yes, it is working. I know you've heard there hasn't been a lot of news about any hiccups or glitches, so we're very happy about that as well.
Let's talk about, again, we're in the second enrollment period, which ends in February, February 15th.
Yes, February 15th of 2015.
The question is a lot of lessons from the first one to the second enrollment period, plus there are some things that are different. First the lessons, then what is different, okay? Let's talk.
I think one of the lessons that we've learned is you have to bring healthcare to where the people are. So we've been working very closely.
Where we are right here.
Well, where we are right here, right, at a federally qualified health center. And so how do we bring enrollment activities to these centers? How do we work with members of the faith community? How do we work with small businesses? You know, they're huge in communities, being not only a conduit for information, but one more place that you hear about what's going on in your community. So how do we bring healthcare and healthcare.gov and all of our enrollment efforts to the people as opposed to trying to bring the people to us? And so that's been one of our biggest lessons learned. We have a large, robust coalition throughout the state of New Jersey. You know, New Jersey is a very decentralized place. We've got a lot of county coalitions that are working to figure out, let's go to this library, let's go to this senior center. How are we at the, the JCC and this church and that church? So trying to bring the information to the people. That's been our biggest lessons learned from last year. In terms of what's different this open enrollment, we have 161,000 plus individuals who last year purchased a marketplace plan. Those individuals will be renewed into plans this year. And so not only do they have the option to go online and shop for a new plan if they want something that's maybe a little bit more affordable, but we have 160,000 plus satisfied customers. And so we've been working really hard with those consumers to have them share their stories and say, this is what this has meant for me, the security of health insurance and the ability to have protections for my family in the case of a catastrophic event or in the case of just getting on a path to wellness. So we're really, that has changed the game for us to have those 161,000 happy consumers talking about the work that happened last year and into this year.
One of the things that has in fact changed, let's talk penalties. There are penalties that are different in the second enrollment period versus the first. My understanding is that they are triple in some cases, and some folks are saying, all right, so I don't have to have insurance, I'll go to the emergency room. I've asked everyone this question about the Affordable Care Act, but you understand this in a way that others may not. talk about those penalties and talk about those who are saying that to themselves, I'll just pay.
Yeah. So to the penalties, I mean, this year you're looking at one of two options. You'll either pay 2% of your annual income, or
Versus one.
or $325 per person if you're not covered.
Which is versus 90 in the first year.
95 in the first year. And so, what we're encouraging people to do is think through the worst case scenarios and realizing that no one plans to get sick, no one plans to have an accident, no one plans for anything major to happen. So if an individual is feeling like, well, I'm just going to keep using the ER for the flu or a sinus infection or what have you, think through what that would look like if they had no coverage. And the other part, I think what's really exciting is think about life on a path to wellness, right? We talk to folks on the ground who talk about when they get that card, sort of the joy they feel of being able to go get dental work done or go get a colonoscopy or go get things that they knew they needed to be preventative, to take care of themselves, to take care of their families, but could never afford. And so think about what your life would look like with that ability, with that that focus on wellness. And that's, I think, where we start to change the dialogue. People will, I think, look at what is available to them and see the benefits of what coverage can bring, whether it's from a dental perspective, from a health perspective, chronic illness prevention and screenings. There's the whole lot of reasons to get covered.
You know, it's interesting. You talk about the Affordable Care Act, and you talk about people signing up, not just as a health care issue, but as a quality of life issue.
100%. I think that we realize that for so many Americans prior to the ACA, medical costs were the #1 cause of bankruptcy in the United States. The stress that people feel, and you can talk to people right here in this health center, when they are sort of worried, chronically worried about what happens if. We've taken that away. We've had great success as well with the Medicaid expansion here in New Jersey. We have close to 400,000 individuals as of this summer get enrolled through the Medicaid expansion, and that is year-round. People can apply and be enrolled in Medicaid.
By the way, before we go any further, why have we been so successful at the Medicaid expansion, in ways that we frankly have been more challenged when it comes to the other aspects of enrolling people?
I think the timing is part of it. There's a finite window of time when you can enroll in the marketplace, and Medicaid is year-round, so you can catch people differently. That said, I would be remiss if I didn't talk about the special enrollment period. So when there isn't an open enrollment period, where we're in right now until February 15th, if you have a qualifying life event, just like if you have insurance from your employer, a birth of a child, divorce, marriage, moving into the state of New Jersey, you can apply to the marketplace at those times. But without that sort of a life event, you're waiting for these 3-month windows. And so because Medicaid doesn't have that, I think you'll see, the numbers will continually be moving up because people can always be enrolling.
For you and the federal government, your colleagues, people often question the role of the federal government. What's the appropriate role? And beyond the politics of this, which people continue to debate, for you personally as well as professionally, what is it like for you to see people here, see them enrolling, beyond the politics, because this is actually about people changing their lives as we speak right now?
I think you can look back 100 years and you can find presidents, Democrat and Republican, talking about what do we do to help our people.
President Nixon talked about this.
President Nixon talked about this, right. So this is not a Democratic idea or a Republican idea.
I don't think he was a Democrat, as I remember.
I don't think so. And so how do we, look back through history and realize that in 14 months, we've reduced the rate of the uninsured by 26% in this country. And here in New Jersey, in 14 months, we've reduced the rate by 46%. Those numbers speak volumes to the need here on the ground in New Jersey, the need throughout this country, and the history speaks to a desire to create a security net for people who need it. Healthcare shouldn't be a privilege. And you'll hear that throughout history, time and time again. And it's, I think, frankly, one of the most rewarding parts of this is to be a small part of changing the dialogue and changing the discourse in this country to move towards a place where everybody has access to coverage.
One of the things I'm curious about is the role of the media, those of us in public broadcasting and covering this extensively, your sense of the role of the media in terms of public awareness and increasing public awareness about what needs to be done regarding the ACA.
I think one of the things that we're hoping the media talks about the most is the ease of the website. It is really easy. I've been pulling it up on my phone and showing people. They're like, you got that information from me in 30 seconds. And I said, Yes, it's that easy, and the website is working that well for consumers. So I think that's one of the biggest tasks, if I can put it to the media, is to help us share that message. You know that the media market here in New Jersey is very unique, and so I think we are constantly figuring out how, as a coalition and as the federal government, how to move within the sort of the uniqueness of the New Jersey market. So a lot of it is working with local micro news blogs, because we realize that sometimes that's the best vehicle to get information out there. But I would encourage anybody who's listening from the media world to help us talk about how good the site is, and how many opportunities are available, both on healthcare.gov and on a website we have here in New Jersey called covernj.org, which is a localized site that speaks to more where can you find resources, where can you go. And I talked about some of the churches and the community centers that we're in. That website has a lot of those pop-up events as well.
Steve Adubato, we're here at the Newark Community Health Centers. We're here with Michel, who is the manager of Outreach and Enrollment, New Jersey Primary Care Association. Good to see you, Michel.
Good to see you too. Thank you, Steve.
Tell folks exactly what your organization does.
So we are the trade association for the 20 federally qualified health centers across the state of New Jersey. So we provide them with technical assistance and guidance and maintaining what they need to do for our federal regulations.
Let's talk primary care, because it's one thing to enroll folks. People are being enrolled right now under the Affordable Care Act. It's so important to me. You can talk about the website, healthcare.gov. You can talk about the process, how challenging some people think it is, and the fact that we're in the second enrollment period as we do this program. But ultimately, if you do get insured, which is what the whole goal is, you need primary care physicians. Do we have enough primary care physicians?
That is a great question. Actually, the shortage of physicians and providers in general is not only statewide but nationwide. But we're fortunate in our federally qualified health network that there are over 300 providers, which include both medical providers and dental providers. So yes, there is a shortage, but there are providers that are accepting the insurances on the marketplace as well as Medicaid and CHIP.
In fact, we are in a federally qualified health center right now where we speak. Describe what that means for folks who don't know. A federally qualified health center, it sounds jargony, and it is, but what is it?
Essentially, it's your community health center or your neighborhood health center that receives federal funding from the government to operate and serve people in their communities. And essentially, they serve populations that are underinsured, underserved, and they're really here for the community.
Let me ask you this, Michel. The primary questions you're getting from folks right now, the primary questions and/or concerns about the Affordable Care Act in this second enrollment period, what kinds of questions and concerns are you getting?
I think similar to the first open enrollment is this issue of affordability. People are wondering, can I really afford this for my family? Is this something I can implement into my budget? And we're also seeing folks concerned about maintaining their current provider. Are they able to still keep the doctor that they have been seeing for years with these marketplace plans? And so in that case, we encourage folks to check with their providers before enrolling in a particular plan that they do in fact accept this particular plan that they're thinking about.
So it's not a simple, is it affordable, yes or no. You're saying, it's interesting, we're doing this around the holiday season, and I'm not going to editorialize because it's not what we do on public broadcasting, but if in fact someone's going to take a lot of time to shop for a holiday present, right? You take some time to shop for your health care, right?
Absolutely, and that's what the marketplace is. It's a place to be able to go and shop around based on your preferences for a provider or even medications that you take. And I would even say with regard to the price, it's in terms of is it something that you can or can't afford for the time being. So we encourage folks to consider all elements of their budget when preparing to go and enroll in a marketplace plan.
Say someone says, all right, well, I'll just pay the penalty. If you don't have insurance, there's a penalty, right? Describe the penalty and talk to folks who say, well, I'll just pay. I won't have insurance, I'll just pay. I'll go to the emergency room, you say?
Okay, so under the Affordable Care Act, all citizens and legal qualified residents are required to either have coverage that meets a minimum guidelines or to have an exemption or to pay a penalty. And this penalty in 2014 for a family or an individual who didn't have coverage is $95 per adult, half of that for a child, or 1% of the total annual household income, whichever is greater. For 2015, that penalty is jumping to $325 per adult, half of that per child, or 2% of the annual household income, whichever is greater.
It's triple, if not more.
Precisely. And the thing we want to encourage folks to think about is the actual benefit of having coverage. the benefits associated with the protection from high expensive medical bills in the case of an emergency or other unforeseen medical care needs that they might come across. And so health insurance does offer that benefit. And so we encourage folks to think about that, but then also the implications that it will have if they do not have health coverage.
Versus, I'll go to the emergency room?
Precisely. And we are encouraging folks to not just use the emergency room as a reactive measure, but really to take advantage of the preventive services that are offered through these marketplace plans and also through Medicaid and CHIP.
Thanks, Michelle.
Thank you so much, Steve.
We're here with Marcia Atkin from the Healthcare Foundation of New Jersey. Marcia, there are people signing up here. You are supporting organizations all across the state in connection with the Affordable Care Act to get folks to sign up because
it's our mission to connect people to health care, to connect the most vulnerable, the most underserved people to health care. And insurance is one tool to do that. It's the first step in a process that's, very important. They have to follow up, they have to use that insurance, but first they have to have it.
And we're here at the North Community Health Centers. We've been here at some of their other locations. It's always been interesting. We were outside the last time, chilly. It was in November, and we're in the middle of December right now. We're in the middle of the second enrollment period. From your perspective, Marcia, some of the lessons from the first enrollment period as we move into the second one, we still need to enroll people. Not only lessons in terms of the government side, but in terms of the public information and awareness side. So important.
Okay. Well, first of all, in New Jersey, we have had a problem. The available money to let people know about their opportunities under the ACA has been very limited. So we have to work very hard to get the word out to communities and let people know why they need insurance and what the insurance is all about. Some of these people have never had insurance and they don't understand how insurance works. So we've learned, first of all, that it takes maybe 4 meetings with somebody to get them comfortable enough to actually enroll and to get them to understand and to bring the right paperwork and, all of those things that are necessary to enroll. So that's one thing we learned. We also learned that in immigrant communities, people are very concerned and suspicious because there may be people in their families who are undocumented. Maybe they're documented.
And the federal government is running this.
Right, exactly. So even though there are assurances that there isn't going to be, cross-sharing of information, they're worried about it. And it's important to reach those people and to have people from the community reach those people so that they can explain and there's an element of trust and they really understand why it's important for them to get this insurance. It's not easy, but we did a great job in New Jersey last year.
Talk about it.
We enrolled about half the people who were eligible to be enrolled, which is fabulous.
Through the foundation?
No.
I'm sorry. No, I want to be clear. Because you're saying of all the people, I want to be clear. This is important. Through all the people who could have been enrolled, you're saying
that New Jersey enrolled, to my understanding, approximately 50% of the people. Now, not all in ACA marketplace insurance. Many of them are Medicaid.
The Medicaid piece was big.
And here in Essex County, the Medicaid piece was far bigger. Our grantees, I think, reported to us something like 75–80%.
Yeah, talk about that.
Medicaid.
Marcia, talk about it. Sorry for interrupting. You talk about your grantees, and I don't think people understand. The Healthcare Foundation of New Jersey is dedicated to funding not-for-profit organizations. Full disclosure, our not-for-profit, our educational production company, not-for-profit in partnership with public television. You fund us, but you fund organizations who are, frankly, more hands-on as well to do what?
Definitely. Well, to do all kinds of things to connect people to quality health care. But in this case, we funded about 12 grassroots organizations to work with people, to teach them about the ACA, to get the word out, and to actually sit with them and help them through the process. So these grassroots organizations have certified application counselors or navigators, and they are helping people actually enroll and understand the insurance marketplace.
It's so interesting. Marcia talked about the fact that it takes several times. You look right behind us, our cameraman Andy, you can zoom in. You see folks that are really, really hands-on. Marcia talks about hands-on. These folks are signing people up. You talk about Obamacare, the Affordable Care Act. This is it in action right here at North Community Health Center. I got to ask you, when you see this happening right now, right before you, you walked in here and we're doing these interviews. This is great, but they're doing the work, signing people up one at a time. What's that like for you?
It's so exciting for us. And, when we fund something, we do it because we think that the people we're giving the money to are capable of making a real difference, that they're really going to be able to follow through on their proposals and make it happen. And to see it in action, to see it happen is very exciting. I just came from another organization, New Community Corporation.
Great organization.
Great organization, where we funded a clinic in one of their long-term care buildings, senior buildings, so that a physician can come into the building and provide primary care to the residents of the building who are either elderly or disabled. These people can't walk the 2 or 3 or 4 blocks that's necessary to get to a doctor. So now they don't have to be transported, they don't have to walk in ice, those who can make it, they're still frail, and to see that actually happen is the best. It's the best.
Probably why you got in this, it's not a business, why you probably got into the foundation work in the first place.
Absolutely, no question. And everyone in our office feels that way. And I think everybody who does this kind of philanthropy feels that way. It's very exciting.
Well, finally, Marcia said, when we see these folks, it's very rewarding. But remember, it took a lot for these folks to actually get into this room, to sign up right now. Language is an issue. Culture is an issue. The lack of information is an issue, but it's very rewarding because one at a time they're signing up, and they will be insured finally after this, right, Marcia?
They will be insured, absolutely. And now we have to do more work to connect them to actual doctors and make sure that they follow up, that they get those well checkups, that they take care of problems before they become critical problems and they have to go to the emergency room.
Which is why this was done in the first place.
Exactly.
Thank you, Marcia.
You're very welcome. Thank you.
We're here with Linda Schwimmer, who is Vice President of the New Jersey Healthcare Quality Institute. Good to see you, Linda.
Thank you. Good to see you, too.
Tell folks what the organization is all about who may not know.
We are a not-for-profit entity. We are trying to improve the healthcare system in New Jersey and control costs of healthcare in New Jersey.
As we do this program, we are actually here at the Newark Community Health Centers. They are, in fact, enrolling people. This is the second enrollment period of the Affordable Care Act, so-called Obamacare. The lessons that we have learned so far.
Well, I think one of the lessons learned was really the importance of the ground game, getting a grassroots effort out to make sure that people knew about the enrollment dates and the opportunity to enroll. We did a great job last year, despite the fact that we didn't have much in the way of funding to support it. This year, I think the efforts at the community level are helped by the fact that the technology is working much better.
Healthcare.gov?
Healthcare.gov, exactly.
How much better? Describe it.
I think it's a lot better. From what we're hearing, they're able to handle the volume, the wait times in both English and Spanish language aren't too bad on the call lines. A lot of people prefer to call. Even if they go on the website, they still want to call and talk to somebody because this is really confusing. And if they don't know what they're looking at, I certainly encourage them to do that. So I think it's a lot better.
Let's talk about some of the other lessons. What's interesting is that some of the small businesses are saying that they're facing challenges. Let's describe what is different this time around, Linda, for small businesses with the Affordable Care Act in the second enrollment period.
I think what's different for both businesses and individuals, first of all, is that there's more choices out there. We have 2 new carriers that came onto the market. United, which isn't new to everyone, but they weren't on the marketplace before, and now Oscar, which is a technology-driven company, which is brand new.
And the other ones were Health Republic and Horizon and
AmeriHealth.
Got it.
And so we've got 5 choices for people to shop. We've got more plan design from all those 5. And sometimes a lot of options can be confusing. And so, again, it's really important that the technology and the phone lines are up and running for everyone. If it's not smooth, people give up. They turn someplace else. And I don't think you're seeing that drop-off anymore. So that's really good.
But what's interesting is, okay, now there are more options, 5 companies in the marketplace, if you will. But, Linda, does the fact that we have 5 companies in the marketplace, what does that mean in terms of premiums?
I think that it really is driving costs down because they are competing for a market that they know is very price sensitive. It's also encouraging them to innovate, to do different things in plan design. Some of the new market,
such as,
well, like Oscar, for instance, they have a plan design where they have a doctor that you can call 24/7, and they describe it as having a family doctor available to you, which is nice because a lot of people really haven't engaged in the healthcare system. They don't have that kind of resource. A lot of the plans are looking at no-cost pharmaceutical deductibles if you use generics, no cost for primary care. What is confusing, though, is a lot of the way the deductibles are structured and things like that. So what we do need is more tools to help somebody plug in what it is they're looking for and then figure out what's the best thing for them. I think healthcare.gov has a long way to be consumer friendly in that regard. So we're getting better, but we still have a long way to go.
And finally, let me ask you this. If you would say what the biggest lesson has been from the first enrollment period to the second enrollment period, other than the whole website and the so-called glitches, if you will. Some people call them glitches, some people call them other things. The biggest lessons that you say we take away from all this?
So I think there's three things. I think that we're seeing that people want to get health care if they can. They're trying to get health care. We're seeing that affordability is really the primary issue, and so having those subsidies is so crucial. And finally, it's just going back to the word of mouth, consumer engagement, the ground game, so to speak. Everybody's got to get out there. They got to tell their neighbors, their friends, and they got to help each other struggle through it.
And public awareness in terms of the media's role here?
This is great that you're doing this and that the foundation is supporting this. There's not enough public awareness. Right now, I think there's still plenty of room on the call lines. They're not, healthcare.gov isn't getting the huge volume that they thought they would get. Although with a deadline coming up on Monday, I think there'll be a real surge. And I think there'll be a huge surge again for all the procrastinators around February 14th, 15th. People spending Valentine's Day picking up insurance.
With media,
handy.
But we have a huge role to play here.
A huge role, huge role. The media, neighbors, things like public leaders, local leaders, a huge role to play.
Thanks so much, Linda.
Okay, thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, Horizon Blue Cross Blue Shield of New Jersey, Bloomfield College, Wells Fargo, PSE&G, Holy Name Medical Center, and by Johnson & Johnson. Promotional support provided by NJ.com, Small News, Big News, True Jersey, and by Commerce Magazine. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
Did you know that the enrollment period under the Affordable Care Act ends February 15th? For those who are still uninsured, you may be eligible for financial support. But those who do not sign up for insurance must pay a fine of $325 or more. Every plan covers preventative care, doctor visits, and prescriptions. And with over 40 plans to choose from, you have every opportunity to get on the road to health.